afternoon, friends. It's Friday afternoon, and we from the Scientific Society of AVMC, the Constituent College of Vinayaka Mission Research Foundation, are back with our 79th episode of Forefront of Future Frontiers. This is a medical webinar series, which actually we started on May 2020, and we've been running almost every week, and I think we have done now out of 85 weeks 78 episodes consistently, and we intend to do this webinar series as much as possible for us. And this is a theme-based webinar series. We have completed 12 themes, 12 series, and right now we are in series 13, where we are exploring quality, and we are talking about continuous quality improvement as a way of life. So that is what this theme is. And we had how to improve quality in hospital services, how to improve quality in laboratory services. And those are some of the themes which we had explored in other talks in this series. And we shall be exploring quality in integrity in research, how to improve quality in publications and access to publications, and how to use accreditations to improve quality in this series yet to come. Today we have with us Dr. Vijay Kautilya, who will be talking to us about quality in teaching learning process. To introduce the speaker and to deliver the welcome note, I'll request our Dean Sir, Professor P.F. Kotur. Over to you, sir.
Yeah, thank you, Professor Mahalakshmi. Very good afternoon to our resource person, Professor Vijay, and to the esteemed dignitaries of national and international tribute in the audience. I especially welcome Professor Ananta Krishnan, then our some participants from far off colleges, and my own colleagues, Dr. Bhatt, Dr. Mahalakshmi, the HODs, and others. Now we are proudly marching towards the 100th episode, and the journey has been quite continuous, successful, no looking back. We are going with a great forward, great force towards that. And now it has become a kind of the tradition of the AVMC. The FFF is another name for the tradition of the AVMC. It continues. And on this occasion, it is my privilege as the head of the institution to welcome the speaker and also all the esteemed audience for this episode on behalf of our management, on behalf of our university. And now I also believe that, of course, you should plan the things and all. One thing is sometimes, many a times, the things suddenly, if you do undertake, unplanned things also work many a times better than the planned things. This is what I think, So anyway, our good friend, my colleague, Professor Vijay, he rescued us SOS. And of course, I don't have any doubt, when Mahalakshmi blew the whistle yesterday, that thing happened. Then I said, give me 5 minutes, 10 minutes, I said, and immediately my brain worked and to identify the right person. And because I've seen Dr. Vijay working or growing or doing work together for the continuous 3 years when I was in Satyasai Medical College. So we are really proud. Those were one of the wonderful days I had in my long career. And our team of medical education are so famous, so dedicated, and so vibrant. That was a wonderful thing we had. And we are all like-minded people, and we're doing with a passion. This is what I can see. So here is Dr. Vijay, who is a committed person, dedicated person, a focused person, and a hard-working and soft person. Okay, and he certainly, I'm sure, with a great hope that he will do justice to this. And his passion towards medical education is quite evident by, in such a young age, he has practically bagged so many of the laurels related to medical education, that I'll be telling when I'll be going through his CV. Now, presently, he is the professor and head of the Department of Forensic Medicine and Toxicology at the Manipal TATA Hospital, Jamshedpur. It's a wonderful thing, He traveled from Satyasai to there. And I'm sure, he has taken over as the chief of the medical education unit over there, coordinator. And certainly with his commitment and a passion, that unit will certainly have a very good future. And apart from his assigned responsibilities, he also worked in very close proximity with me. He was a deputy controller of Toxicology Vidyapit, and the things he used to do in a very meticulous way is certainly they are quite green in my memory. Of course, he finished ACME, he finished FAIMER, everything was there in front of me only. So it's really it's a wonderful thing. In addition to that, he has added a couple of more things like an advanced course in medical law and ethics from Jamshedpur University, Switzerland, and this postgraduate diploma in medical law and ethics from National Law School, Bangalore. So these shows that a person is quite never stagnant. He always likes to grow in terms of knowledge, grow in terms of experience. Such a person is over here, and he will be talking on one very important topic of today, is quality assurance in education or a teaching learning process. And as I'm myself being little inclined towards this medical education, I also think there are a couple of thoughts which will keep the things going for Vijay. This nowadays, what the common thing what we read or hear quite often is the quality of the education is going down, quality of the doctors is going down. This is a very common thing. If I remember correctly, ever since I was a student, I've been seeing this. Okay, that is one thing you have to keep in mind. And because of that, there's some lot of arousal has happened across the globe, across India, and the medical education is undergoing both reforms and reformation as well. So finally, the regulating council has awakened and new curriculum has been rolled out at a UG/PG level. That is what we are amidst now. And whether it is a traditional curriculum or this new curriculum, this quality has have to be there. Otherwise, there is nothing, no charm in that. And if you remember, we recollect the why we want a quality in education. And for that, one or two thoughts I like to share. The curriculum and the community health were linked by the scholars not recently, long back, dating back to 100, 200 years. Curriculum and the community health were linked. That they had realized that, the if you want to have a quality of the patient care, quality of the community health, that means you have to address that issue where the, the, the professionals to offer that care are being produced, that is in the medical colleges. That means that's what you say, if you impart a quality education, certainly the product that is coming out of will be able to give a quality patient care. That's how it will take care of the needs of the community. That is one link, certainly to keep in mind. And I already said, even dating back to what is this name? Abraham Flexner's report in 1909, that time he has realized that the quality of education that was being imparted in various medical schools in United States was so bad. That's how they came in, and that was the reason. That means quality has been an issue, and then quality is never static; it's always dynamic, and there is always a scope for enhancement. That is one of the thought. That is how the quality in education is important. It is the responsibility of the teacher, the responsibility of the student, the responsibility of the administrators, and the responsibility of the management as well to take care of this quality. Another one or two thoughts on this is the medical profession has come under the Consumer Protection Act, and the quality of the doctors. Gone are the days when the doctors used to be considered as gods, so the doctors are sued. You keep reading, keep hearing in day-to-day affairs. So the quality of the care that has to be there. So you have to have some perspective from that angle as well. And another thought is, see, so many phenomena have happened to various processes, like globalization, globalization of education, and internationalization. Internationalization is the engine of globalization. Privatization, commercialization. These are all the phenomena that have happened to even the education, and they have their own effect or impact on this educational process. So unless because of this process, the globalization and internationalization, the product that is produced here in Are Accredited Medical College has to go and work in some other corner of the world. Unless it has a quality, it will not be accepted there. So the concomitant to these phenomena, the quality is again very essential. So from any point of view, if you take quality assurance, quality sustenance, and quality improvement have to be a part and parcel of the day. Even now we are all undergoing NAC, we are undergoing NABL, NABH, our regulating body, University Grant Commission, day in, day out. This is only quality, but nothing else but the quality. So these some thoughts come to my mind, and certainly the topic what Professor Vijay has chosen to share his thoughts will be a wonderful thing. Let's all hear to him. Once again, Vijay, we welcome you for this platform. Thank you very much.
Thank you very much, sir. Before we hand over the mic to Dr. Vijay and ask him to continue, few housekeeping announcements for the participants. Please keep yourselves muted so that the audio quality is good for everyone. And this program is being live streamed as well as being recorded for future academic use. Over to you, Dr. Vijay. The stage is yours. You can share your screen now.
Do that. And the screen is visible?
Yes, yes.
Yes, yeah, it is. Good.
Thank you very much, sir. I would like to first thank Dr. Kothur, sir, for having me here. And it's a great honor for me to honestly be able to speak in front of such great stalwarts and mentors like Dr. Kothur, sir, Dr. Anand Krishnan, sir, and even Mahalakshmi, ma'am. I have started my career with most of them and learned a lot from them. So I would certainly hope that I do justice to their expectations in this talk today. So with that, we'll be talking about quality assurance of teaching learning process in a medical school. Now, considering quality, that's quite a sensitive term when you talk of to many of the faculties, right? It elicits a lot of mixed emotions when you talk of quality, more work, documentation, futile exercises, and honestly, work seems much easier than keeping track of what quality is all about. So that's kind of a response when you get about quality when you talk of in most of these. So I'll do my best to sell this concept of quality in teaching learning process, not disrupting the process as such while trying to maintain quality. So objectives of today's talk will be by the end of the sessions, you will be able to identify the need of quality assurance in teaching learning process. You will be able to understand the key components of the teaching learning process and the need to evaluate them for quality. And you will be able to identify different mechanisms in which quality assurance processes can be applied to these different teaching learning systems and processes. And most importantly, I would like to see that the people who have come across this talk should be able to value quality assurance rather than despise or get scared about it. So with that brief talk, I'll just take a few minutes to have a small poll with all of you. We'll just move to Mentimeter. I would request all of the participants to just log into a site called menti.com and use this code. And you will come across this small poll that we are organizing. So let's take a call about quality, right? And if you start imagining you are getting into a medical course and you have just started, you have a counseling that you are attending, and you have a set of colleges that come to your mind that you want to join. How would you rate these institutions? You just have to log into mentimeter.com and it will ask you for a code for a test. And yeah, just by giving the code, I think this question should pop up in your screen. And I just want you to grade these 4 different terminologies or different colleges, categories of colleges that you can come across. Yeah, I think
the code is in the chat
in.
box also.
Yeah, sir. Great. I think we have already started getting responses. I think as you can see, majority of the people opted for AIMS, and then comes government colleges, then other medical colleges which are recognized by Medical Council of India, and then we have new medical colleges. I think this is quite obvious when we consider all the faculty. Majority of the faculty or people in our country would logically think in this way. Now let's try to understand why, right? Yeah, government colleges is slightly getting more number of options here. Fine. With this, I'll move on. Now, having rated different colleges, I'm sure you would have thought of some kind of parameters of quality. Why would you want to get into those institutions when you want to do the medical course? So let's start thinking of some kind of a key criteria, or what was the reason you opted for that rating? What was the key criteria that you could actually consider, or rather you have taken this call on? Now, this is a word cloud. You can just type in your different opinions, so that we can have a look at what is the measure of quality for all of you for a medical college. Then each of you can take up to 5 responses here. Yeah, patient load, quality of the faculty, stability of the institution, sustainability, resources that they provide. Yeah, minimal standards, do they meet them or not? Quality itself, okay. Resources, sustainability, upgraded equipment, okay, that's new one. Quality, ranking, okay, accreditations, rankings, different caseloads, sustainability, yeah. Premier institutes, yes, some institutions are a brand in their own, right? So they themselves describe what is quality all about. State of the art facilities being available there. So there are multiple factors. Fees, yes, fees is one major factor with the wonderful set induction given by Kothur sir. I think with privatization of medical education, I think the major criteria or major aspect which is coming across is how costly is the education going to be there. Yes, I am. Thank you very much for all these responses, and I think we'll stop here right now. The infrastructure, all these things, we are going to discuss these things as we go ahead. I'll come back to my PowerPoint so that we continue our talk. Yes. So as all of you are aware, quality has a lot of meaning. So when you want to define quality, I think the term quality as such evolved. So related to product management or product development. Now, if you talk of quality of any product, you would actually think of an AG mark or an ISI certification of the product. So what does quality actually mean, right? Most importantly, the term quality evolved as a value for money that is offered, right? How well does your funding or your money get justified by getting there? Now, basically, the word quality literally means it's a kind of a degree of excellence. And when you say a degree, it is something that can be measured. It's not an abstract quantity, right? And when it can be measured, that means it needs to be monitored. And if it is monitored, it can be managed as well. Now, this whole process of measuring, monitoring, and managing quality leads to something called as quality assurance. Now, quality assurance collectively means all those ongoing processes of evaluation, assessment, or monitoring that you take up in an educational institution or a program. What are you generally trying to do? You generally try to bring in accountability and improvement. Now, when you talk of accountability, we are looking at regulations and accreditations where your institution is branded as something which has value. Now, that is something what you have also brought in the poll when you talk of premier institutes, recognized institutes. They have much more value compared to institutes which are still not accredited or which are in the process of developing. Improvement on the contrary talks of how well does the institute grow or how frequently does the institute improve. Now, all these processes which are built in a system which bring in assessment of these elements is what is called as quality assurance. And quality assurance is a process that involves two integral processes. One, the quality assurance can be assured something by an internal process, and it can also be assured by something which is more popular, something called an external quality assurance process. Now, internal process, which I personally feel has more value in keeping quality or raising standards, especially when you're talking of quality improvement rather than for just assessment. Internal processes talk of all those measures or events that you take. It's an institutional process taken by the institute for its own development. Now, external quality assurance processes require universities or higher external bodies which monitor an institute, and they have a set of criteria which they would have developed to assess an institute, and based on the criteria, they accredit or value the institute. Now, when you want accreditation or accountability, generally, these needs to be brought in by external agencies. You cannot have accountability where you have only internal processes to judge or measure the quality of your capabilities. But yes, when you're talking of only of improvement of your own quality, yes, internal institutes and internal assessment processes do have a lot of value when you come across. Now, considering this definition of what is quality or quality assurance all about, let's move on to the next element of our topic, that is the teaching learning process. Now, the essence of education. What is the essence of education? I think Page long back has brought in. A university is considered as an habitat, a society, a community, an environment, or even an ecosystem. And it is primarily judged by the quality of life that it fosters, right? What are the kind of opportunities of growth, experimentation, and exploration it provides? The question is not just what is the outcome or what is the product that is brought out, but the value is more for a garden, or how does the process of growth happen in that place. Now, the process of growth is where you have the heart of an educational institution, that is the teaching learning process. A teaching learning process happens to be the most important core competency, according to me, when you talk of a higher educational institution, because the whole process of education depends on the teaching learning process adopted by the institution. And bringing in the element of quality is absolutely necessary. It has to be an integral process which works hand in hand along with the teaching learning process, and not just something that happens only in the end. When you end up doing a quality assurance process that evaluates the teaching learning process only at the end, you might have accreditations and this, but the process of improvement is very, very limited. That's what you would actually come across in most of our nationalized accreditation councils and their criteria that follow. We'll come to that as we discuss further. So further breaking down educational process for better understanding of how to apply quality assurance to this. Now, the whole education process can be summed up among these 5 sub-processes which we can consider. One is curriculum design. Next comes a pedagogical design, implementation of the quality, outcomes assessments that happen, and the resource provisions. Now, what is curriculum design and how do you assess quality? Now, as a faculty, I would want to ask, who develops the curriculum? Are the outcomes of a curriculum known when you are actually looking for qualities? Are the faculty involved in developing the curriculum, or are there committees formed who actually plan? Are the stakeholders involved in the curriculum? So these are a few things which I would want to know to see if quality actually exists in the curriculum during the process of development. So these are some things which will actually later provide us with metrics or concepts which help us evaluate the teaching learning process for quality assurance. Now, pedagogical design. When you talk of an institution, the first thing I would want to know as a faculty is, what is the spectrum of teaching learning aids that available with that institution? How broad is the teaching learning aids or the concepts or the methods adopted, right? If you come across medical institutions, majority of the times when we talk of knowledge domain, people limit themselves with lectures. And when you talk of clinical scenarios, majority of the times it's just bedside clinics. What new is being adopted? Now, considering our competency-based medical education curriculum that is being brought out, regulatory authorities, MCS, consciously brought out an element of improving these methods, different pedagogical methods, considering different competencies that have. Can I request the participants to please mute here? Yeah, so different pedagogical methods. So as a faculty or as an assessor of quality, I would like to know what are the different elements of different methods of teaching learning tools that you have adopted. How differently do you provide the same concept of teaching and learning, right? Yes. So implementation quality. Yes, you might have a variety of methods being followed, but the next question is how well is it being executed? Now, this is the biggest question which comes across when you actually design a curriculum for competency-based medical education. Wonderful schedules, wonderfully aligned topics, small group discussion elements are being put out, but the challenge is the implementation. How well do you actually implement those interventions that you have come across? Assessing this quality of implementation is very, very necessary to come across or to understand quality assurance in teaching learning process. Now, the outcome assessment. So what's an outcome? Outcome is a graduate who comes out of your institution. An Indian medical graduate that you produce is the outcome. And how do you assess the outcome? How much does the society or the community value the graduate that comes out of your institution? I think one of the very important question I would like to ask is, are the employers satisfied with the people coming out of your institutions? Now, all these things and resource provisions. What are these resource provisions? Yes, the institutions have budget allocations, and for a teaching learning process, I would also want to understand as to what is the investment or what is the value that the institution is ready to provide to contribute towards teaching learning process. Now take CBME for example. Age-old methods of bedside clinics are not sufficient, especially when you want to actually do something like certifiable skills. Now here is where the element of finance and funding comes in, right? So you would want to establish a skills lab, you would want to establish simulations, you would want to do a lot of other things where you would want to actually implement all these things. Now here is where resources matter, and the percentage or amount of resources being allocated towards teaching learning aids definitely do have an element or a say to understand the value given for quality by the institution. So all these things together certainly somewhere play a very valuable role in assessing quality or providing assurance of quality. Now, subconsciously or consciously, most of you would have actually looked into different elements of these kinds when you actually selected a college or opted for a college, right? So you would look like what is the caseload, because caseload is what decides as to how you actually learn the skills, right? What are the kind of facilities available? What are the kind of teachers available, right? How well can they deliver to your needs? So these are different elements which come across when you see these sub processes for assessment, and this is where we have to concentrate as to evaluate quality assurance in teaching learning process. Now coming to this assessment of quality itself, broadly when we consider this, the quality assurance mechanisms in place work under these three, what I can say as mechanisms, right? First is accreditations, next we have assessments, and then there are audits. Now, what are accreditations? Accreditations determine whether an institution or a program has reached some kind of a threshold quality, right? It is generally a binary phenomenon. You are accredited or you are not accredited. And a lot of times what happens is these accreditations are done by external agencies. Like for example, take Indian scenario. There are multiple agencies which can try to accredit a medical college, right? The most popular and the most contributing one is what is NAC. NAC is both for accreditation and assessment that you can come across. And even MCI, for example, if you consider, accredits or gives value to an institution. And the World Federation of Medical Education, they also have a set of guidelines and these regulations. Other than these, certainly if you see different universities accredit different colleges, different group of universities, private institutions, private consortiums, all of these can actually contribute towards accreditation of these institutions. Similarly, assessments can be done both by external agencies and also by internal agencies. So they generally help to evaluate quality or specific educational activities or program, and not just the institution as a whole, right? And audits are more limited to an interinstitutional process where you talk about quality review process. As we go ahead, we'll talk about a little more in detail about these. Now, accreditation deals exclusively with education, and it is a term which came into quality assurance mechanisms in educational fields, right? It generally talks about an institution or a program level. And for accreditation, generally there is a criterion reference. Now, if you talk of NAC, NAC has given us specific criteria. Even Medical Council of India has set of criteria as to what courses can be accepted in your institution or how well. So it generally tries to compare and observe performances against some kind of preset standards that usually determine accrediting agencies. And because accreditation performs a certification function, it has to be done by an external source. It cannot be done internally in an institution or organization. Generally, an accredited institution guarantees some kind of a minimal standards being met, right? So it's not actually grading, but it's an all or none phenomenon. Assessments normally evaluate quality of specific educational activity, right? Assessment tends to grade and tries to give a spectrum of where you stand. It tries to rank things and it tries to give academic value to what you are talking about. So assessments generally operate at subject or program level, and they also can be done by external agencies or institutional consortiums together can accredit institutions, or the institution themselves can arrange for themselves getting accredited by different processes, right? And accreditations need not always have a strong influence of external criteria. Institutions can develop their own assessment criteria. So just for an overview, thinking of accreditation process and assessment process of the teaching learning process adopted by NAC, we'll just have a look at different criteria that are being adopted for considered when we talk of teaching learning methods or teaching learning and evaluation. Now, NAC, among the 7 criteria 2 talks primarily about teaching and learning, right? And in this, key indicators or key criteria which NAC has attempted to evaluate so as to accredit an institution or these. Student enrollment profile. Now, this is what talks about what is the merit of the students, what is the different profile of students that come to your institution. Now, this itself is an indicator of quality. Now, the initial poll that you've taken, majority of your opted for AIMS. Now, AIMS, logically, if you speak, is a quality in itself because Indian standards, you believe that it has some kind of a quality and people opt. So depending on the best category of students going there, so it has to have value. So catering to student diversities. What are the different students when they come to an institution are belonging to different places, different communities, different levels of intellect. Now, how does an institution cater to these things? Does contribute to the teaching learning process. So then there is the teaching learning process as such, where different teaching methods, different outcome variables, different assessment processes that are being allotted, all of which are considered. Teacher profile. What is the profile of faculty that is involved in teaching? How many faculty you have? What is the quality of the faculty that are involved and how frequently do they update themselves? All these things help understand what could be the quality of teaching that is brought in to an education. Evaluation process and reforms that are being brought out also help improve teaching learning process. Student performance and learning outcomes give you an overview of how good the teaching learning process was in the institution. So how well the students actually take up what you are actually wanting them to learn. And finally, customer is where you have to go to understand whether your teaching learning process was satisfactory, and that is where the student satisfaction surveys come across. Now, considering these different elements, assessments for quality assurance of teaching learning process have been developed. But one thing we need to very strongly remember is, unlike other criteria for assessment and accreditation, teaching learning process is subtly different. And teaching learning process, to be effective in quality assurance, you have to consider these key concepts or factors. Now, whatever the assessment process or the quality assurance mechanisms that you design, you have to see that these facilitate and ensure the process continuously for quality improvement rather than for just bureaucratic accountability. What happens to us with NAC and MCI criteria is something which all of you would have noted. It is more about documentation rather than actually developing the needs. It's not a continuous process. Majority of the times when you actually end up looking at criteria for these accreditation agencies, they are usually annual processes or something which happen after 5 years, and the moment you get accredited, people tend to get relaxed. So only relying on external accreditation criteria will not be sufficient. Your process of quality has to be developed in such a way that it actually harbors improvement. Quality assurance, especially for teaching and learning, has to be facilitated as a bottoms-up approach. Teacher is the most important element in quality assurance in education and the teaching learning process. So involvement of teachers, teacher groups is very, very important to actually improve the quality of teaching learning and also contribute towards quality assurance. Now, assessing the quality has to be a top-down approach and it cannot be the other way, right? So institutions can adopt policies where they have a top-down approach for auditing, but not for developing quality assurances. And most importantly, whatever process of quality assurance in teaching learning you adopt, you have to see that there is less and less burden involved. It is very, very rational and it is individualized towards the institution, because generalized criteria and concepts sometimes do not work. Only then they will be effective. Non-burdensome, because yes, what we have noted is generally accreditation processes from external agencies require so much of documentation that they take up so much of time, which sometimes, I am sure all of you would agree, hamper the quality development or improvement in teaching and learning, right? It becomes more as an exercise of documentation rather than the process of execution. So quality must be the responsibility for the teaching staff when it comes to teaching and learning. And it is not an individual's job, it is always a group responsibility. No individual person can assure quality in the institution, right? External institutions and external agencies can create criteria and norms which generally can help measure quality or can even enforce quality, but they will not certainly be able to satisfy the needs of quality assurance in teaching and learning processes, specifically when you talk of. Yes, because having specific criteria, if you come across, the reason being why this World Federation of Education, all these nationalized criteria have come across, one big very advantage is try to standardize education all over the country or nations. But the problem with standardization is also about loss of differences among the institutions, right? Some institutions develop indigenously and some, the room for innovation is usually attempted to be corrupt. Now consider this, right? You should switch to plastic flavors because that reduces variability. Variability is not wrong. Variability sometimes is good and can help innovation also. So accreditation should not hamper innovation indirectly. So this is where I would consider audit being one of the very strong methods of accreditation, or rather not accreditation, a very strong measure of I guess quality assurance, especially when you talk of teaching learning process. The quality, also known as quality process reviews, are found on base principles where you believe that good people working with sufficient resources and with a good process deliver excellent goods. Now the process here is a very important element, because if you do not adopt an effective process, even good people and lot of resources do not do the job. Audits generally are taught to be taken up at an institutional level, right? So this is where accountability is reduced, but the practicability of these audits is much higher because they are less demanding than actual assessments and accreditation processes. Because there are so many accreditation processes going on, generally people get confused what norms to follow, and sometimes these accreditation processes are limiting. Take minimum faculty criteria for MCA assets, right? Majority of the institutions don't read the word minimum, right? They feel that is the maximum number of faculty that you require for delivery of the curriculum. And that is where is the limitation comes. So individual audits, institutional requirements have to be brought in, and we can determine that with audit only, unlike with accreditations and assessments, we can actually really understand what the teachers do and how they do. It is much less complex because it has less parameters that you can around. You can tailor yourself, and it adopts a quality process review sidesteps that predetermined outcomes and measures the standard. So you don't actually require some kind of a predetermined criteria. It can be a continuous process where you adopt and you will try to develop these criteria over time. It is more strongly valuing something what is called a self-study, internal assessment processes and plans for improvement is more in audits compared to that of assessments and accreditations. Finally, when we talk of understanding these different criteria that can be adopted to quality assurance, we can think of 4 different domains or other processes that you can come across. So, quality program framework. So what does this mean? So, here is something where you talk about, you have to assess whether an institution or an organization has a policy of maintaining quality. Are there specific missions written? Are there policy statements guiding as to what quality means to them in different sub-process of teaching and learning that you come across? Formal quality program activities. That means, are there events or methods adopted in the institution which attempt to measure their own quality? These kind of things complement. Quality program support. Now, yes, you have a vision, you have a policy statement as to what do you mean by quality or what is the quality you want to achieve. You have incorporated some measures in formal quality activities. Now, are there support mechanisms which help develop these measures or also improve quality in institutions? Funded projects, activities undertaken, special teaching development units which actually propagate quality, without which all the other measures fail. And value and incentive. This is very, very important because intrinsic and extrinsic rewards of different kinds is what drives quality in teaching and learning. Now, considering these 4 different domains and applying them towards the actual sub-processes that we discussed in quality, we can come across quality as quality assessment for teaching and learning in these. Now, these are some of the criteria which I feel effectively can be used to evaluate if an institution is in the right direction considering teaching and learning process. Take curriculum, for example. To evaluate the curriculum design, the framework of regulations need to show whether the program level vision statements are achieved. Are there goal statements which are specifically mentioned which help develop the curriculum? And when you talk of assessing the curriculum that is being developed, I think you need to ask whether the curriculum being implemented is being reviewed. Now, here where if you consider our MCA regulations, this is where the curriculum committee, the subcommittees, all these committees, the medical education unit have been brought in, where they monitor, review the curriculum, whether it is being implemented or not. Further, at lower levels, even departmental reviews can be conducted at different departments and assessment of the curriculum can be performed for quality assurance. External examiners. Yes, one good example of quality assurance in the curriculum process is where assessments happen through external examiners. People from outside who come and who give feedback on the curriculum and who evaluate the curriculum definitely certify quality also. Now, how does an institution see development in quality? How does an institution develop a good curriculum or a design? Yes, we have to actually assess how much is the institution supporting good curriculum development through visiting scholars, practitioners, consultants. Nowadays, a lot of institutions and colleges opt for stalwarts, developed people who have worked in the fields as consultants and advisors who actually help their own faculty develop curriculum. Now, that itself can be a quality assessment process and policy improvement process also, correct? And usually the value given here is intrinsic for a curriculum development, right? When you develop your own curriculum, how fit is it for your own use? Does it actually deliver what you actually want? And the next question is, does it satisfy the accreditation rules that you come across? Take MCA, for example, the curriculums are being now put up on the MCA websites or college websites. MCA is adopting external people for actually evaluating these curriculums, right? Designed by different colleges for different institutions for CBME and stuff. So that could be one example of how curriculum design can be assessed or evaluated. Moving towards pedagogical design, there are teaching learning methods that you are actually adopt. Now, for assessing the quality here, you need to understand whether the institution has a policy of improving the teaching and learning, or are there no guidelines as to how teaching and learning can be scaled. Now, one way of understanding or measuring whether teaching learning methods improve are There are review committees which actually review the teaching learning process being adopted there. Now, how do you support these teaching learning innovations? You can actually do workshops, individual consultations with faculties and teachers. You can organize teaching methods, development of projects, micro teaching exercises sometimes encouraged. So any institution working on these lines definitely will harbor quality and help quality assurance as well. And value and incentive towards improving the teaching learning methods. Yes, faculty's personal conviction is very, very strong motivation towards improving quality. And for an institution, adopting a teaching learning method that is best suited financially, simultaneously coming out with good outcomes is what you have to consider for pedagogical design. Implementation quality. Yes. Now, heart of the teaching learning process, as I told you, is how well is it implemented. Now, talking of the guidelines or processes that you have adopted, we have to look into whether there are written statements of teachers' quality and the balance between teaching and research. Right? Are there set criteria given by the institution as to how should a teacher behave? How much time, how much of effort does a teacher involve in teaching and learning? Policies regarding student feedback and teacher feedback. Are there mechanisms set in designed in the institution which actually take value and assess these feedbacks regularly? Teaching and learning qualities assurances and committees, right? So whether there are multiple committees which actually look into the implementation process of this. Medical education unit is a very strong example when you consider this in most of these institutions, right? So what do you measure? How do you measure these? Student course evaluation questionnaires, right? Taking feedback. Like here in Manipal, we have board of studies, and in every board of studies, the curriculum is reviewed. And the board of studies happens periodically where the students actually give feedback on the process of implementation as such. And that feedback helps us contribute towards further improvement in the curriculum or even make drastic changes if required in the process of implementation. Student teacher consultation committees where the students give teachers feedback and vice versa. Peer review of the teaching, right? And whether your own colleagues are encouraged. Healthy peer review can be a very, very effective method of improving teaching quality in an institution, requiring participation of teaching development activities under specific circumstances. Yes. So what percentage of faculty are actually trying to improve their skills? Help improve the quality of implementation also. So quality programs, yes. Are the institutions funding quality, well-funded teaching development units? Medical education unit is being made mandatory, and after that, maybe the institutions are actually growing. Expert assistance on the design and process of teaching, evaluating questionnaires. And are you adopting expert advices on the processes that you are actually adopting? Now, what provides value and incentive for developing in this line? Yes, professional pride, care about the students. Students feel very, very proud of being participating in such kind of a teaching learning processes. Teaching awards. Yes, the institutions can actually develop best teacher, best quality teacher awards, which incentivize faculty in developing these things. Inclusion of teaching evaluation in staff reviews and promotion criteria. Very one strong argument about these regulation criteria we have always is only research has been considered as a part of promotion committee criteria as per MCA and not the teaching abilities or the different teaching skills that you have. That is a flaw which regulations have to work on. Peer pressure. Yes. Peer pressure can sometimes work in a positive way where people tend to develop their own skills to keep up with their competition. Talking of outcome measures, outcomes talk of the product of what the institution produces, and we have to look into institutions as to how do they have policies as to monitor their outcomes or the products for a period of time, whether they fit the needs of society. So this can best be done by tracer students or graduates. So you keep track of alumni, students, what are they doing, what further courses they have done, how are their career graphs improving, how are they contributing towards the society and the roles they are responsible for. And you can actually talk to your employers of your students who can give you excellent feedback as to what quality of teaching learning process you have adopted. Are the students sufficiently getting out with the outcomes that you have actually promised? Now, this is a complex process requiring research projects, dealing with student outcomes, expert advice, outcome sources and all. And institutions should have a strong intrinsic desire to track their students and keep track of how the students' career graph takes, so that you can actually have a quality assurance in your own process and projects. So talking of resources, yes, is there a policy for how to allocate resources? Now, as I told initially, budget for what percentage of fund is allocated for teaching learning process and innovation in teaching learning, both of which help improve the teaching learning quality and also deliver improvement in teaching learning quality. So innovation can only come with funding required for more research. Nowadays, we have actually wanting to talk about something called as evidence-based education as such. So the need for developing evidence that the institution or the teaching learning process works is very, very important. Now here, the most value-driven process or resource process that you can come across for incentives is desire to maintain or enhance the staff size, right? So depending on the needs of teaching learning, how equipped or how satisfied is the institution in developing, improving the taking more faculty as per the requirements. Now this is one major argument we had. And teaching evaluation at the time of appointment. What kind of appointments are you taking up? Whenever you go for an interview, I'm sure institutions lot of times flaw here where they take up faculty only for MCI requirement and not based on what abilities does a faculty have. Now that becomes a very limiting factor in incentivizing faculty over time as to whether they are valued only because of the accreditation needs or because of the services they can provide. So altogether, when you consider accreditation or quality assurance is a long drawn process which requires multiple facets, and especially individualized institutional audits are highly recommended when you actually consider quality assurance in teaching learning. And looking at multiple criteria that we decide, it can be kind of a threatening process to look ahead, but it is up to us to make the process much more acceptable. So accountability through assessment or process review is very, very important in quality assurance. And without accountability, even those of the best institutions might over time start valuing different things because multiple factors come into play of a development. So this is where the accreditation bodies and things have to be valid. Quality assurance is a process driven by something which is self-awareness, self-criticism, and self-study. And this is where the audit can work best in an institution, where institutions can develop their own teaching learning process audit systems where quality assurance can be maintained. So colleges and universities, accountability for education quality must reach all the way towards the level of the teacher or the department where quality assurance can be granted. I think this is an overview of what teaching and learning processes can be assessed for the quality assurance in teaching learning. I'd like to stop here and maybe take up some questions the faculty.
Yeah. Thank you very much, Vijay, for that very elaborate and very specific things. One thing, when I was listening to you, you made a very strong, emphatic statement that quality assurance process should be non-burdensome, rational, and effective. And you use NAC in the same sentence. So I'm not very sure whether they go hand in hand. And I'm sure there are many in the audience who will do with that. Okay. Yeah. And I'd like to remind you, Dr. KRS also has joined today's session. So you have a very big audience and just today to follow. But a few questions we have in the chat box. I'll take one by one. First one is from Dr. Vishnu Bhatt, our Director Medical Research. He wants to know that now that we are going in for a lot of skill lab based or simulation based training, which is replacing bedside clinic and outpatient teaching. So how do we maintain quality in such situation? I'm sure there are various methods.
Yes, ma'am. Ma'am, right now I think the skills lab based methods which are being taken up are not a replacement for the conventional clinical teaching that we come across. They are rather, the problem with CBME that we have found is it is more opportunistic kind of a learning when you talk of a clinical based scenario, right? And that is the reason why skills labs are being brought into. And I think skills labs are for initial training and certification of students, and they are not a replacement for I think quality assurance. And yes, they themselves can serve as a measure of quality because it is much easier with a skills lab to assess a student compared to a real life scenario where we talk of workplace based assessment methods and all. So considering teaching learning processes, rather skills labs I would feel is more easier method for assessment and accreditation.
Correct. That I agree with you. because we'd be able to do in a more stepwise fashion. There's one question when I was listening to you, which came to my mind. You used audits, surveys, and opinion polls from students and feedback mechanisms as one of the important assessors of internal quality assurance in this thing. But what we have done, or what we see normally, is the students and teachers have this invariable positivity bias. Have you done this? Yes. I have done it 200 times before itself. Or how is the class? All excellent. So this positivity bias is a very major problem, especially if you are going to use surveys and opinions from students. Do you have any suggestions on how we can overcome this as a tool to measure quality?
Yes, ma'am. Ma'am, the biggest problem with accreditation assessment is when you actually publish the results of what the assessment process was about or the outcomes of the assessment are. For example, the reason I believe the students want to be friendly with the faculty is they do not really want to hurt faculty or expose faculty. So I think keeping the feedback sessions informal rather than taking a more formal feedback might be a better way of getting proper feedback rather than
but if you take informal feedback, then you can't write paper based on that.
You can't write a paper based on that. But
okay.
That's the advantage of audit, where you can have your own tailored down processes, internal quality assurance. It might actually work better than accreditation assurance.
Okay. Thanks, Vijay. Thanks for taking up. I'm seeing Kotur sir is waiting to ask some questions. Sir, over to you.
I don't have any questions. I don't have any questions to Vijay, but certainly I must compliment him for presenting his thoughts systematically. Now, Vijay, what do you think is the role of the students in the quality assurance?
So student, sir, with the student-centric curriculum that we are actually developing, so the teaching learning process involves the students' participation very much, and the quality of teaching that can be offered depends a lot on the students also. So that's where the students come in, and where we talk of, I think even when you talk of quality, the faculty perspective also, there's a very strong argument among faculty as to the quality of students that come in to an institution that gives value. Because one reason why people generally believe AIMS has to be one of the best institutions, but along with the best facilities, faculty, and facilities available there, the best students also go there. So the whole process of quality is complemented. So as good as the input, so can the output be.
Okay. Thank you, sir, and thanks, Vijay, for taking that comment. One comment from Professor KRS is there in the chat box. A good overview of quality assurance in education delivered in the time allotted. Well done, Professor Vijay. And Dr. Shivashakti agrees with him. Okay, one more question to sum up or to finish this discussion. What do you think that the frontline teachers, the tutors, the senior residents, the APs and all, because a lot of things what we talked about in quality, looks at things from a broader perspective. It is looking more from high top-down approach. But what do you think that the student, for the teachers who are in frontline teaching, should be doing day to day in their life to ensure that quality takes the center stage?
Ma'am, as I told you, one very important quality which in a person which brings out quality is the need for own improvement. So as long as I feel the faculty, the younger faculty, constantly strive to build their skills, improve their skills, and contribute effectively towards curriculum, they are open to change and adapt new things. I think they will effectively contribute towards quality. They should also consciously try to be open towards their own self-evaluation and improvement. So all these factors, the faculty themselves, I think the quality assurance starts from the lower faculty, the teachers, because unless they contribute, they evaluate, they self-evaluate and self-assess, quality can never be achieved from top-down process.
Okay. Maybe prepare lesson plans, take peer evaluation, collect feedback,
So those also need to be included. I see Dr. Balchandra Kohli also has joined and sir has unmuted. Sir, do you have a question to our speaker?
First of all, appreciation. It's a great talk by Vijay. We had missed it, but today he had made up.
Thank you, sir.
Which is at the heart of the whole system and the issue for today's discussion. Just one thing, am I audible? Am I audible?
Perfect. Perfectly, sir.
Okay.
Yes, sir.
I wanted to talk about, say, what is in terms of practical terms, what is the mechanism and the tool which can really help teachers to grow? We talk about feedback, we talk about mentoring, and we talk about the freedom of choice, because I think the theories of motivation, these are the three things which are very, very critically important. Now, for teachers, are we supporting them? For example, when it comes to, let us say, friendly critique, he mentioned about micro teaching. Micro teaching is usually held as a formality, but it is not followed rigorously. So why not we take up this exercise continuously over a period of time, so that the teachers are given proper help and support. Secondly, we'll talk about logbook for the students. Why do we have portfolio for the teachers? Because portfolio is a wonderful instrument for reflection, for growth. So if we say that our teacher has to maintain a portfolio, of course, definitely the lesson plan which talks about the content and delivery, etc., how it addresses. But the role of portfolio is to understand, did I do justice today? What happened today? What is the new angle which I'm seeing for the next time? So this will have to be discussed with the mentor. Obviously, we today will talk that mentoring is not necessarily HOD versus the junior member. It can be just a pairing and mentoring relationship which is full of trust, love, and confidence. So I think if we take up the techniques like peer review, friendly critique, and in the scope of maintaining the portfolio, it can provide a very rich evidence, not only for it's an evidence for growing. There is a focus of quality, because quality is not static concept. But I know that Vijay has repeatedly talked about many things, and he has not missed anything. So I congratulate
you, sir.
And best wishes. Thank you very much.
Thank you very much, sir.
Thank you, sir, for that comment and this thing. So Dr. Atkoli also brought out, and also in the chat box, I see Dr. Shruti has also brought out about micro teaching and peer review. Somebody who has done this micro teaching and peer review for many years, can we invite opinion from Professor Ananthakrishnan on how we can institutionalize this process of continuous peer review of faculty?
Thank you, thank you, Maha, and great job, Vijay.
Thank you very much, sir. Thank you, sir.
Lots of new things to learn and digest. The first, I'd like to give a few comments. One is, I personally think that quality cannot be brought about by external accreditation. And because we know that it is so infrequent, and it only results in obfuscation and blurring of facts and creating of a virtual world at the time of the accreditation process. There is no guarantee that those which are accredited and get high marks are better than those who are not accredited and get low marks. You know that, I know that, everybody knows that. Therefore, quality has to come from within. And the internal quality mechanism which you must build in your institute is the only one which can ensure. It's like your conscience keeper. You cannot bluff your conscience, and you cannot tell lies to your conscience and pretend as if you have something that you do not have. And therefore, the power of the IQAC has to be increased, and its role in what you said, measuring, monitoring, and management, and also in initiating, because that one word you did not mention, because very often left to themselves, the initiation requires a driving force. It is not likely to come from within the teachers, overwhelmed as they are by their daily workload. That is the first thing that occurred to me during your talk. Secondly, I am all for this bottoms-up approach, because fresh thoughts have to come from the bottom of the pyramid. But along with accountability, there has to be simultaneously recognition, valuing, and incentives. Now, you may decry and say a teacher is there to teach, there is no need for incentives, but I do not agree, because all teachers are human beings and they're required to feel valued and recognized for their efforts, even if the incentives are not in the terms of tangible things which are visible outside, which system does not exist. Which means that you have to value scholarship which goes beyond the conventional measurement of scholarship as by regulatory agencies, which again does not seem to be happening. And in my mind, I don't see the movement towards total assessment of scholarship and valuing taking place in the next 5 or 10 years, because it's easy to measure what is measurable, and what is measurable is the number of papers. And that is how they measure that, and the place where you publish it as an index of scholarship. And the third is that this quality measurement, just like the curriculum that you mentioned, it has to be systematic. It cannot be opportunistic. Once you rely on external accreditors, it becomes opportunistic. All the activities take place for a year before the intended accreditation process. And then you go into a Rip Van Winkle type of situation till the next accreditation is due. So I think the movement must begin from the bottom, and the accreditation process should not bring about uniformity and equalization and generalization, which is what they tend to do, but they should drive innovation and therefore give more credit for innovations, which is not happening either in the NAC process or the MCI process. Of course, it doesn't happen at all. Even in NAC, the weightage for innovation is very, very little. If you see the 7 criteria of NAC, the lowest weightage is for the best practices and the distinctiveness, which is very unfortunate, because in my mind, they are much more valuable than resources, physical resources, or teaching learning, because there in health science, you have to follow regulatory norms. Some minimal standards have to exist. So I think it calls for a lot of thought and a lot of movement from the bottom to make it genuinely a quality-driven initiative and not a forced quality-driven initiative coming from a central agency. And that is the moment that we must try for. And I'm sure in course of time, some systems similar to that must take place. And then only we recognize genuinely good institutions. And what you said last is the most important, because if the processes are to be efficient, then the input quality has to be good. If the input quality is substandard or far below the required minimum, and we have no method of measuring it at present, except for the single entrance exams, which I do not know whether it really measures quality. And therefore, we cannot assure that the processes will produce an outcome which is equal across institutions. Anyway, I enjoyed your talk and I made some notes and I'll read it up today. Thanks, Vijay.
Thank you very much.
Thank you very much.
Thank you very much for those comments. And I see Dr. Shiva Shakti has raised her hand. Dr. Shiva, you are here?
Yeah, ma'am. Good evening.
Good
Good
evening.
evening, Dr. Vijay. Happy to listen to you after a long
Nice to
time.
meet you.
Yeah,
Pleasure,
actually,
ma'am.
I like
Pleasure
the
to hear
point very much which you brought into place, that the appointment of the faculty based on some MCI or the DCI norms, and they don't check for the quality. And apart from that,
Quality.
even the number of faculty also we are targeting only based on the norms. It is not
Minimal norms.
what is the, if the vision of the university is to get something higher, then the ratio of the faculty appointment should also be the same. And if the internal quality assurance has to be strong, then the job description for the faculty should also be very perfect. Like in the beginning of the year, you tell the faculty this is what is expected from you, and then at the end of the year, you do the performance appraisal in the same line. But that is not happening in that manner. The faculty is not given any particular job description, but at the end of the year, the performance appraisal is done in the way whatever that suits at university that at that particular point of time.
Absolutely.
So if we are going to continue in this phase, then it is very, very difficult to establish this quality among the teachers. And the performance appraisal also, as you told, that for a teaching faculty, if they have chosen that teaching is the predominant area of their job description, then based on how much of innovative teaching they have done, how much of technology tools they have prepared, that should become the performance appraisal platform.
Absolutely.
And if they have chosen research as a predominant job working area, then you can have the publication as a factor. And if they have already as administrators, then we should have what are the policies they have developed. So that customization and the performance appraisal and flexibility is much needed at this point of time. This I'm talking as a base level faculty.
That's a good one, Shivashakti. You covered your tracks well.
What is meant by base level?
Base level in the sense, if I am the entry level faculty, if you ask me a feedback, this will be the feedback, because if there is no clarity on what is the outcome expected from me, then I may not be able to work towards the outcome what is expected. So when we talk about outcome based education, the employment should also be outcome based. Tell what is required and then see whether it has achieved or not.
What is required is that you be jack of all trades.
That is, then we have to compromise on several areas, ma'am. That is because what is happening is when the faculty are loaded with multiple responsibilities, the inadvertently what is affected is only the UG teaching. The UG teaching is getting compromised so very badly because of the additional responsibilities. That's what is happening everywhere. We are keeping everything only on papers. All our quality systems are remaining in papers, to be frank. Everything, if it has to go to the ground level, then this thing has to change.
Okay,
Thanks,
thank you.
Dr.
I
Vijay.
think
We'll
we'll
Thanks,
stop
nice
the
points.
discussion at that point of time.
Yeah.
On behalf of the Scientific Forum of AVMC and Vinayaka Mission Research Foundation, we'd like to thank Dr. Vijay for his wonderful lecture today. And we would also like to thank all the participants and the people who contributed to the discussion for making this session very interesting. We will be moving on in our journey towards quality management systems next week also, when we keep talking about publishing. And again, that is a major area which is almost a landmine kind of thing. And there is a lot of movement now towards making publishing accessible to all faculty and making publishing accessible to all the common man also. So that what has come up is the open access publications, and we thought that that is some area which we should explore in this particular platform. And we have a very nice speaker, Professor Balabhaskar. He is the former editor of Indian Journal of Anesthesia and past president of Indian Society of Anesthetists. He is the professor of some disturbance system. He is also the professor of anesthesia, Vims Bellari. So he will be talking to us about what these open access publications are all about, and how they will help to improve the quality of publications and access to knowledge for all the people. So that is the talk for next Friday. I hope you would find time to join us. Till then, we'd request you all to stay safe, and hope to see you in the next FFF program. Thank you very much. We would like to close the session today.
Thank you.
Thanks, Vijay.
Vijay, thank you.